Hello and welcome to a special edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are dressed up for the occasion, our Freedom podcast celebrating the 4th of July and independence of our nation. 200 and some years ago in 1776, when we declared freedom from the tyranny of a kingdom of England. And here we are this many years later celebrating this. So we want to just talk about that and talk about how it has to do with our health. So we're going to be talking about food, family, and freedom and how it links to our health. Janet, you first. When you think of food, what do you think of when you think of how it changes our health?
So healthy food versus processed foods is probably the biggest thing that comes to mind for me. And the freedom to choose what food we have is also an important thing. But being raised in a background where people had gardens and fresh vegetables and fruits, and we had markets too, and we still in our small towns do have markets where you can actually buy locally. I think that's super important because even now you can buy your local beef, you can buy your local eggs, you can buy the produce that is raised in your community, honey, things like that. Is super important, and I hope we don't lose that right.
So you must be alluding to something about you're concerned about losing our right to have good quality food.
Well, there is this thing called we take away people's water rights. We don't allow them to, or we want them to register their gardens in some states. We're just having overreach in the arena of our own personal space as to how we conduct our lives.
Well, let's not forget that China is buying a lot of farmland, and some billionaires that don't believe in cattle are buying some farmland also. So that is kind of spooky. Even in our area, we have some of those people like Bill Gates that have bought some farmland in our area, and that's very, very concerning. So you talked about healthy food versus processed foods. If you had one way to define a healthy food in one sentence, how would you define that?
Don't eat anything that doesn't rot.
Oh, don't eat anything that doesn't rot. So that basically means that if bacteria and funguses won't eat it, then we probably shouldn't either, right?
Probably not.
I mean, you got to kind of ask yourself, how can you assimilate that food into your body if bacteria and fungus can't even do that? Correct?
Well, you do assimilate it. It's just how you assimilate it. It's not the healthy
all
way.
Extra calories.
Right. And
no nutrients.
Right. And the nutrients are lost because of how the food is assimilated in the body. So if you're eating processed foods all day long, the absorption of your nutrients starts in our mouth and travels throughout our GI. So if most of it's happening in your mouth and upper gut, by the time we really need some of those nutrients to be absorbed in our lower GI, it doesn't happen.
Well, let's not forget not just nutrients per se, macro and micronutrients, but also, good bacteria and good fungus. I mean, there's good bacteria and good fungus that our GI tract cannot live without. And you get that from food sometimes.
Right. So you carry pounds of bacteria, whether it's externally or internally. So we as an organism living require that balance to happen. And if we offset that balance, whether it would be in our GI by like maybe an antibiotic or poor food choices or excessive alcohol or, over-the-counter medications, then obviously that's going to affect your outcome of your health.
Absolutely. So let's move on into family. So, our podcast is health focused, and we'd like to focus on health. So if you had to define health and family in the same paragraph, what would you say?
I think with the American lifestyle, I would say an active family is a healthy family.
Okay, that's pretty easy. So what are you saying about that? What do families know about activities? How do families learn about activities?
Well, it starts with parents really young in a child's life and it continues throughout. But personally, I think there has to be things that engages in the outdoor to be healthy. I mean, that's something that's super important. I know Shawn and I are pretty rural, so we get to go outside whenever we want. But even in the city, it's important to find nature and being outside. So you have to be proactive and do it.
Well, from our experience, we have kind of a health journey with our family. When I had a health weight loss journey, 14 years ago now, and our family in general wasn't very healthy. I can blame it on myself because I wasn't eating very healthy. I wasn't being as active as I could. And until I changed that and I lost weight and I changed my eating habits and increased my activity, that's what led my family to change. I can't expect my kids or my spouse to change their habits if I'm still have the same bad habits. You agree with that?
Well, sure. You have to make it a goal and you have to achieve it. And really, most people don't realize it's small steps that get you there. So when Shawn's talking about his journey of health, one of the things that we chose to do as a family is decide what went into the shopping cart and what didn't. And so those choices were helped by the kids because they got to see okay, this is a good choice. This is not such a good choice. What do you think Dad would really need to be healthy and what he doesn't need to be healthy? So there's ways of doing it without having to make it enjoyable and fun. But and also, if you don't bring it home, it's not a problem.
Yeah, I mean, I can attest to that. I would eat a lot of junk food if it was in front of me, but one of the things is just don't buy it and don't have it, and then you won't eat it.
Right.
And the most difficult time for me and most people in general is at night. When they're sitting around their house and they can have an unlimited food supply, an unlimited supply of junk food in their pantry. And it's hard to say no to that sometimes.
Well, I think that's true too. But if you watch people throughout the day, they don't always know how much they're either bringing to work or eating in the car. It's just a constant thing. So I think one of the things that helped our family is we had set meal times. And that is important. Because if you're sitting down and talking and you're sitting at your table rather than eating in front of the TV, it makes it for less times that you're going to go back for seconds or eat more, or when you're full, you're full. So the activities around eating I think are important because I think there's a lot of people that eat without even realizing what they are consuming.
Well, you mentioned driving and you mentioned eating in front of the TV and at work, and all those are what I like to call distracted eating.
Right.
So you're eating when you're distracted. So you can just keep eating and there's nothing to really take you away from that because you're so distracted. So in general, stay away from eating in the car. Just don't eat while you're in the car. If you have a scheduled time to eat when you're driving, then stop and eat inside and don't bring food in the car because it's just next thing you know, all that food is gone. Don't eat at work and don't eat in front of the TV. Sit down in front of at the table and have a set time to eat, and it just is a lot more difficult to overeat.
That's true.
So what are your thoughts about tracking calories and tracking macros?
There are some really good tools. I think for most Americans, serving sizes are lost. We always are big sizing, super sizing, shareables, those kind of things. So I think to start with, people need to know what sizes are as far as how much something is as far as caloric intake, because I really don't think they understand that. There's scales, but also read the packages. Micro and macro, you can get lost in that. I think the first place is to start with how many calories you are consuming and what the calories are. Is it protein? Is it fat? Is it a carb? And let's be fair about it. not all are equal, right? And if you're talking about sugars and carbohydrates, if it's not real and it doesn't rot, probably you shouldn't eat it.
Well, and you spoke of packaging, which, you also said about processed foods. Most things that are in a package are processed foods. So a lot of times the best way to track your calories is with a food scale. And
Oh, that's true. Yeah.
you can argue that is, it is extra work, but start weighing out your food. And if you have a serving of ribeye steak, weigh it, and that way, and track your calories. And that way you will kind of more understand in the long run about what portions are and how to eat appropriately. I think a lot of people don't understand, what a portion of what a portion size is, and it's a lot smaller than what most people understand.
Right, and it can be deceiving. I mean, if you think about something like peanut butter, it's very caloric dense, and a little bit goes a long ways as far as calories, and that's okay if you are spreading it across, a sandwich perhaps. But if you're eating it in a spoon, which sometimes we do because you're hungry, that can add up really fast. So, you need to know how those calories are spread out in certain types of foods, because obviously there's less calories in an apple than there is tablespoons of peanut butter. So but yet the apple's bigger.
Yeah, exactly. And it's mostly because of fat content and fiber content in the apple, and a lot of water in the apple. So as we move on to this podcast, in the third subject we have freedom. So what does freedom and health mean to you?
It's changed in the last few years, but freedom and health shouldn't really be an issue. We should have the freedom to decide what we put in and intake into our body on a personal level. And that really is screaming from the healthcare side. When people are dictating to other people that they're supposed to do something or are required to do something, that's not freedom. That's dictatorship. And that's, some people might say I'm a little crazy, but, that's what happens when you go into countries that have a dictator dictating to people, or, fascism, communism, all that, because you have no control over your own entity. And that's frightening, because then that means it's not this time it might be this, and next time it might be that. And the exposure of what we are being exposed to without understanding what the outcomes or the consequences are, you just do it, to me is not freedom. That's actually a total different situation.
So what about our healthcare system? Do you believe our healthcare system is mostly government controlled in the United States?
It is government controlled, but it's also big pharma controlled, insurance company controlled, which all kind of leads back to the same thing. And the powers to be do not have our best interest at heart. Usually you follow the money, you follow what the outcomes would be if we followed what they said. I used to believe blind faith that, people had our best interest at heart, but I don't think that's always the case. And that's been proven in the last 4 years.
Yeah, absolutely. So if there was one way to liberate yourself from the government healthcare system, what would you tell people that would be?
Well, the first thing would be take control of your choices. Don't let somebody else tell you have to before you're, already past the point of no return. Because, you hear stories of people that don't get second opinions, or they took a vaccine that they didn't want, or, they did something because they were told they had to, rather than deciding it was best for them by educating themselves. The other place that you can do this is choose people who are actually practicing in a ethical manner. So if your doctor is not willing to have a discussion and give you options and choices, and he only says this is the only way you can do something, then I would choose another provider. I mean, that would be an important place. That could be also with your children. If your pediatrician is telling you you have to do X, Y, and Z, and you're not comfortable with it, and they're not giving you any options, I would choose another provider. So walk with your money in your pocketbook.
Yeah, go with your pocketbook for sure. So what about being able to liberate yourself from the healthcare system by making good, healthy choices in the first place? Can you discuss that?
Sure. So, Shawn always says that health is the best insurance policy is yourself and making those choices. And I absolutely agree. What we do every day in our habits makes a big difference as to whether we have to access. And not so much if you got hurt in a car accident or something like that. We always know that those are things that, you can't plan. But your everyday habits do play into whether you have a chronic illness, or if you do have a chronic illness, you do need to work on the things that you have control of. And I think that's one of the biggest problems with our sick care model is we don't give control to the client or to the patient that we are in charge of our health and we are in charge of our everyday decisions. So whether it's food, activity, or sleep, making those choices are super important, and finding somebody that's going to help you do that and understands that. So we have the analogy, would you go to the dentist with crooked and yellow teeth? And most of us wouldn't, but we access a healthcare system right now where the person in front of you is not a healthy individual, and neither are their outline staff. And so they're not promoting the activities or habits that we need to have a healthy body. So, I always tell people, think about that, beware of that,
Yeah, as healthcare professionals, we should be good role models in our health also, right?
Yeah, I agree. Set the example. And also somebody should give you the options that you have for, if you have high blood pressure, talk about the discussion of foods that would help, activities that will help, sleep that will help, to be able to get to the root cause and to eliminate things. Don't always jump into taking something for the rest of your life and assuming that that's going to be the norm.
Yeah, 80% of all doctor healthcare visits are due to chronic disease that are probably preventable, whether it be hypertension, whether it be high cholesterol, that's a whole other story, or whether it be sleep apnea, or whether it be type 2 diabetes. Yeah. Those are all preventable with lifestyle changes or reversible with lifestyle changes, but that's not what a lot of patients are told.
No, they're not, because we are in the model where you only get 10 minutes and they check the box rather than listen to you. So I don't know how you can really do a very ethical exam. You're just check the box, next. And I think that to get out of that system and go to people that actually spend time and can help you is important. And people will say, well, I can't afford that. Well, we do know providers that do offer services to people who actually are on Medicare and Medicaid because they can't access their physician anyways in the sick model that we have in Western medicine. So, there's people out there that can help you, and research, and don't accept answers just because. Look for yourself, look for your own answers.
So are you basically talking about going to a provider or a doctor that doesn't accept insurance, and that's how you'll get better service, better quality, lower prices, as you're talking about?
Well, if they find you as the consumer and you are having a transaction face to face, the value has changed. And so we've lost sight of the idea that healthcare is not a commodity, because it really is. That is a service. That service needs to be between individuals that have skin in the game. And if he sees you as the person that's going to do the trade, he's going to pay attention to you more. And also, he's going to have your best interest at heart, because somebody else is not out of the picture saying you will do X, Y, and Z before you ever get paid, or I'm going to give you this incentive to give you thousands of dollars more if you have this person do something. So it's totally between you and that doctor or practitioner. So that transaction is different, and they're more likely to listen to you because you are paying the bill. not somebody else like insurance or the government. Somebody is not standing over them saying, if you don't meet this quota of this or prescribe this, or you don't ask for this test first, that whole thing is eliminated.
Well, it's crazy how so many people complain about poor service in healthcare and expensive prices in healthcare and poor quality. And then they brag about their insurance covering things or not covering things. So what their answer is they got to find a new doctor that bills their insurance or a new clinic that bills their insurance. And that's really the definition of insanity. When people try to chase a new clinic to get better service, it's not the clinic necessarily and the doctor's issue. I mean, they are accepting that insurance, but the issue is that it's the insurance that creates the problem. So you're right. If you go to a doctor that doesn't bill insurance, you'll get a lot better service at a lot less expensive price.
Right. And you also have access to them.
Right.
Good luck trying to get a hold of somebody. I mean, I work in healthcare. Good luck trying to get a hold of a provider. You can't get past the first person in the first desk. And I don't know sometimes if they even understand what you're asking. So that can be quite a difficult thing. And then if you leave a message, they might return it. And they have these portals now that you can send messages to, but who's answering them?
Yeah.
Who's really answering you back when you sent a question? Most likely not your doctor.
Yeah, I agree. Let's see. So as we wind this podcast up, Janet, what would you like to say to people about our country and the future of our country and the freedom of our country, especially as in regards to health?
Well, if you ever thought that health wasn't a political issue, you lost sight of that one. That it's coming to the forefront. It's a big thing right now, and it's a big thing for providers, whether you're if you're a medical doctor prescribing, or if you're a nurse practitioner or a PA, or if you're a pharmacist or a nurse. We're all fighting for our rights to practice in a ethical manner, not a dictated manner. So we better stand up and fight, because this is like the last forefront, I believe, that we have. If we have no right and autonomy over our own body, then all of our freedoms are lost.
I agree. And when you look at history just look at Marxism, for instance. One of the principles of Karl Marx and Marxism was the government needs to control healthcare. And if the government controls healthcare, then they can control people. And we were just talking about the payment systems of healthcare, and that's kind of how the people have been controlled with their healthcare. But remember this, is that just like you said, we can be liberated from that system if we pay for first of all, take charge of our own health, be good and be good at taking care of our own health, and then choose providers that don't accept the government system or the insurance system. And that will liberate us from that government system, because what a lot of people don't realize, and I write about this in my book, is if you have some kind of private insurance, Premier Blue Cross, United Healthcare, and you think it's good insurance and you think it's private insurance, it's not private insurance, it's government insurance. Because the government is dictating to them what to pay for at what price. So if you have traditional health insurance whatsoever, Medicare and Medicaid, or any kind of Premier Blue Cross, United Healthcare, any kind of traditional insurance, then it is government insurance and it is controlled by the government. So the way to liberate yourself from that is get out of that system. First of all, be healthy yourself, and then get out of that system.
And we need to realize, too, that system hasn't been in place that long. We call it the traditional, but it hasn't been in place that long. It was just when Medicaid and Medicare were brought in. So let's be honest. People have practiced medicine for thousands and thousands of years without some state board or government agency telling them how to take care of their patients. And they did it ethically and did a great job. So make different choices, I think, but also put some pressure on the people that are trying to make these decisions for us, whether it's your local health department or your state, because they need to hear from the public too that they don't appreciate what they're doing. Making mandates to people without ever giving people choices is totally unethical. It's just wrong. So we need to stand up, make decisions that are going to give freedoms for our children and our grandchildren, because if we lose the autonomy of making choices for our own body and are required to do certain things, you guys, we are not in a free country anymore.
That's trouble. That's very troubling. So, well, thank you, Janet, for all your great information, and thank you, listeners and viewers, for tuning into Health Solutions today. Please comment, share this, make sure that other people know that we are only a generation away from losing all of our freedom. So if we don't stand up and we don't educate our kids and our grandkids about what is going on in our country, we are going to lose all of our freedoms. But the good news is we don't have to lose them if we fight for them. So tune into our regularly scheduled show, 12:30 to 1:30 Pacific Standard Time Monday, and follow us on our adventures for 4th of July. We got some exciting things coming up for you tomorrow. So thank you for tuning into Health Solutions with Shawn and Janet Needham.